Hello, my name is Sumaya Raghavan and I have with me Anand Srivastav and Vilma. We are from Revive Heart Foundation Eye Care, Holy Family Hospital, Bandra West, Mumbai. And this project by the name of Revive Heart Foundation was started 4 years back by three main doctors here, Dr. Brian Pinto, Dr. Yash Lokanwala and Dr. Manju Sinha. They started this project because they lost a lot of their friends, their doctor colleagues. Dr. Desai was giving a speech between doctors and he collapsed. He had a cardiac arrest. Dr. Rakesh Sinha, a marathon runner, and he was jogging up Pali Hill one morning and he collapsed there, which is very close to our hospital. By the time they rushed him to our hospital, he too was declared dead. Similarly, a lot of lay people in our country died due to a sudden cardiac arrest due to lack of knowledge. People do not know that if somebody collapses in front of you, what you need to do till medical help arrives. So this is the reason why this project was started. And from then till now, we have trained more than 120,000 people, which includes police personnel, fire brigade people, railway personnel, college students, and even corporates. And we're very happy to be here in front of you today. So let's start off with the topic sudden cardiac arrest. Many of us have heard about this name, but it's not very familiar. But a heart attack is more commonly used. So the first thing we need to understand is that a heart attack and a cardiac arrest are two different things. So coming to a heart attack happens when the arteries to the heart get blocked. They get blocked due to so many reasons: long time diabetes, high cholesterol, smoking habits. And because of that, the arteries get blocked and blood doesn't flow freely to the heart. So what does a person feel? He feels chest pain, jaw pain, shoulder pain, excessive nausea. He sits down and says, I'm not feeling well. Please take me to the hospital. I'm getting a lot of chest pain. So you put this person in a taxi or a car and rush this person to the hospital. This is a heart attack situation. But a cardiac arrest is totally different. A heart that pumps like this, even your heart pumps like this, the heart just stops. And because the heart stops, the blood doesn't reach the different parts of the body and our brain. And if the blood doesn't reach the brain, in 3 minutes, the brain goes into a damaged condition. The person goes into a coma, and 10 minutes he's gone. Now tell me, if somebody collapses in front of you, who's going to help this person in 3 minutes? Are you going to reach a hospital in 3 minutes? Is any doctor going to assist you in 3 minutes? Or is an ambulance going to reach you in 3 minutes? Chances are very slim. So who's going to help this person? You are going to help this person. But when are you going to help this person? When you know what to do. When you don't know what to do, you're going to rush him to the hospital. So we are here today to tell you what you need to do in these 3 crucial minutes. But when I say somebody collapses in front of you, every collapse is not a cardiac arrest. A person could have collapsed due to so many reasons. He's not had breakfast in the morning. His sugar level has dropped, hypoglycemia. He may collapse. Overdose of medication could be a reason of collapse. Fits could be another reason, or even a drunken person collapses. So many various reasons for collapse. So the first thing we're going to teach you today is how to recognize a cardiac arrest. Secondly, we're going to teach you CPR or cardiac massage. And the third thing we're going to teach you today is how to use this machine. This is called an AED, automated external defibrillator. In lay language, it's called a shock machine because this machine gives a shock to the stopped heart so that it starts pumping again. But this is not for doctor use, it is for your use. You must have seen in movies the doctor takes the person to the operation theater, gives a shock like this, and says he's okay. This machine does the same work, but that is a big machine. This is a small portable machine with which our project, we're putting it in various places here in Mumbai. You must have seen a lot of these at the airports and at the big malls also. So how to use this machine, we are going to teach you today. So we're going to go through a presentation. We're going to show you some slides, show you a small video, and we're going to teach you in very non-technical language. At the end of the session, do ask us a lot of questions. So I request Anand to start off with the presentation.
Thank you so much, Sumaya. Good morning, everybody. My name is Anand. Uh, Today, we're going to learn something very, very important, very crucial, and it's known as a life skill. That means the kind of information that would potentially save the life of a person one day. So I request, if you have a pen and a paper, grab it quick, and whatever you deem important out of this entire session, keep writing those things down. You never know when this information might come in handy. Okay? All right, let's begin. And I'm going to begin with an observation of mine that I've had a few times, and I'm sure you must have had also. And that is, let's say you're walking down the road one day, you have some kind of work, and then you're walking down and you happen to see a person collapse. uh, when you do that, when you see that happen, you're going to observe that a lot of people get collected, a crowd gets formed. And you'll also observe that not a lot of people actually take a step forward and try to help the person in need. And the people who try to help that person, probably just one person, two or three odd people. Otherwise, all the other people are just watching him and not really doing anything. And at a certain point of time, they just leave. My direct question to you is, why does that happen? Why is it that we do not want to help the person when we can visually see that the person is in need? So we understand the reluctance, and we understand a few reasons why people don't really help each other. We also understand the fact that it's not like people are not sensitive to the situation; they are, but a few things make them hesitate. So the primary reason we think people don't help is because everybody's a bit worried about the cost. Now they think, if they try to help that person, if something untoward happens, there is a possibility that they might get embroiled into a case, or they might have to face a lot of inconveniences where they might have to go to the police station over and over again, etc., etc. And that's why they don't really take a step forward to help. So I would like to say something about this situation. Now, this particular problem became quite chronic in our country. And that's why in the year 2016, our government, when I say government, I mean specifically the Ministry of Road Transport and Highways. So they formed certain guidelines, and they named those guidelines the Good Samaritan Law. Now, the government, via these guidelines, have advised the cops that if they happen to reach a place where they're looking at a person trying to help another person in need, they're not supposed to be asking the identification of that person. Because if they do that, the people get scared generally. The people who are watching, they get scared, and the people who are trying to help, they get scared. And the next time something the same thing happens, they do not want to help people. That's why the cops have been advised not to ask people for their identification and treat those people with respect. Also, the same thing has been advised to the hospital, where if a person is bringing in an injured person, the hospital is not supposed to ask the identification of the person via giving them a form, right? And also, they are not supposed to be asking for any admittance fee, right? So I've told you this so that the next time you really can see a person who's in need, do not run away or do not walk away. Just try to help that person. The country is with you, the law is with you, and the police is also with you, right? The second reason why people don't help each other is because they don't know what to do. Now, if you don't know what to do, how are you going to help? And specifically when it comes to sudden cardiac arrest, you wouldn't know what to do. So we're going to tell you more about it. And the third reason is COVID-19. So, this session is not about COVID-19. So we're not going to go into depth about it, but I just leave you with one advice here, which is, any single time that you're going to help a person in need who's a stranger in a public space, be sure that you're following all the COVID-19 protocols. Be sure that you have a mask on your face. And if the person who you're trying to help does not have a mask on his face, and you have a handkerchief maybe or a dupatta maybe, cover his mouth with that and then try to help that person. Okay? All right. Wilma, can we have the next slide? Okay, if you see this slide, you should be able to see a person in a sitting position, apparently unconscious. And if you look, you'll see the same observation that I just described a few minutes back. A crowd has been formed, and a lot of people just looking at him, but not really trying to help that person, right? Why? For the same two or three odd reasons I just told you, right? They don't know what to do and they're scared of the cops. Now, if you ever happen to come across a situation like this, uh, you, I am assuming you're going to call the ambulance, which is the right thing to do, and somebody of the crowd also calls the cops, which is also the right thing to do. Now, what generally happens is if a person has called the ambulance, they're not really doing anything to help any which ways. They're just waiting for the ambulance to arrive, and whatever is going to happen next is what the ambulance is going to do. They are not really going to do anything, and not because they don't want to, but maybe because they don't know what to do. So we understand that part. But I want you to know one thing over here in this situation. If the person at that moment has collapsed because of sudden cardiac arrest, At that point of time, regardless of the fact that you may have called the ambulance, it's absolutely important you help that person. Why am I saying that? Because that person is not going to have enough time. He's just going to have 3 minutes of time. Within 3 minutes, his brain is going to get damaged. Possibly, he's going to go into coma, and in about 10 minutes out, he's going to be no more. And you know for a fact that the ambulance sometimes takes time to arrive, not intentionally, but for some reasons. For example, traffic. So there's a lot of traffic, and the ambulance is trying to arrive on time but is not able to. So if it's arriving, say, after 10 minutes of time, 10 or 15 minutes, say, by the time 4 to 5 minutes have already gone by, the brain is already damaged, the person is gone into coma. 10 minutes, he's no more, right? So be aware of this, and just remember one thing: every single minute you delay in initiating help, remember that person is going to die by 10%. So if you keep thinking for 10 minutes, the person is already gone, right? Okay, Vilma, can we have the next slide? Okay, you see this slide and you should be able to see three people here. I'm sure you must have recognized these people as well. Christian Eriksen, Rimala Gucci, and Dr. Kalam sir. Now, for the football enthusiasts, you must have recognized Christian Eriksen immediately. Christian Eriksen is a Denmark citizen. He's a professional footballer. Rima Laguji, of course, you must have seen her on television, in the movies, and Dr. Kalam Saab, he was our former president, right? Now, all the three suffered sudden cardiac arrest, but Rima Laguji and Dr. Kalam Saab, they're not with us today. They did not make it. But Christian Eriksen happened to be the lucky one, and you know he is he had sudden cardiac arrest on the field while he was playing, and then he got revived by paramedicals, and he's happy today, and he's back on the field. But I have a point to tell you by showing you the faces of these three people. But before I tell you the point, I want you to notice the ages of these people. If you look at Christian Eriksen, he's a bit young when it comes to age. Rima Laguji is a bit elder to him, and Dr. Kalam Saab, of course, he's the eldest amongst the three. Now, my point is the sudden cardiac arrest is one thing that can happen to anybody, anytime, regardless age. Okay, it does not make any distinction when it comes to age. If if somebody's of the opinion that it can happen only with people who have maybe crossed 70 in their 70s or maybe 80s or 90s, that's not true. It can happen to children as well, right? And also, it's not just regardless age, it's also regardless fitness levels and regardless gender, which means it can happen to a person absolutely fit of health. He's got a great diet, he goes to jog every day, he works out every day. It can happen to that person. It can happen to a man, it can happen to a woman, it can happen to a third gender, right? Okay, Vilma, can we have the next slide? Okay, this is a differentiation between heart attack and cardiac arrest. Please pay attention here. This is very, very important. Now, generally, people do not understand that these two are absolutely different. Heart attack is different, cardiac arrest is different. They are not the same, right? Sumaya has already told you that earlier. Now, we would like you to know the difference also because the way to help each is different. So, let me begin by heart attack. So, what exactly is our heart? Our heart is a muscle. So, it's a muscled organ basically. And the primary function of the heart is to pump blood all over the body. Like it supplies blood all over the body, right? Now, what we generally forget is that it supplies blood to itself as well. Now, it supplies blood via arteries known as coronary arteries, right? The problems that we are talking about occur in these arteries, and they are known as blockages or plaques, right? Now, the problem that the blockages create is that they stop the supply of blood. So, the bigger the blockage, the more the supply of blood is stopped. And if the person hasn't taken any medication for it, the blockage keeps growing, and it keeps growing over time. And at a certain point of time, it's grown so big that it's covering the entire artery, which means it's 100% blockage, which means no blood is now going anywhere in the body. Sometimes these blockages break as well, and the same result happens. So if no blood is going anywhere in the body, no blood is going in anywhere in the heart either, because of which the muscles and the tissues of the heart, I'm sorry, they get damaged and then they die. And this is known as heart attack, right? Now, let me tell you the symptoms of heart attack so that you understand, you recognize that, okay, if you look at a person, if it's happening, you will be able to understand, okay, these are heart attack symptoms. So let's assume you're walking down the road and there is somebody ahead of you and he's showing these signs. So what is it that you're going to observe in that person so that you recognize it's a heart attack? Okay. The first thing you're going to observe in that person is that the person is going to complain of massive chest pain right in the middle of the chest. You'll also observe that he's perspiring all over his body, also his face, right? You're going to see cold sweat all over his face. You might observe back pain, left shoulder pain. You might observe jaw clamping, and you may observe that he's become suddenly very weak. And if he was walking in, ahead of you, he suddenly stopped walking and he can't walk any further. He's just sitting down, right? And you'll also observe that he suddenly has a difficult time breathing. Okay, so these are the symptoms of heart attack. If you ever happen to come across a situation like this where you're looking at a person showing these exact signs that I just told you, it's so important you rush that person to the hospital immediately. Do not waste time at all and do not take any risk thinking it's something else. Generally, people don't rush the person to the hospital thinking maybe it's a gas problem, maybe it's indigestion problem. So the advice that they generally give to such a person is, sit for 5 minutes, you're going to be okay. I'm going to get some water for you. I'm going to put some in the water and give it to you, and you're going to be all right. But you please don't take that risk. Rush that person to the hospital. Chances are you will end up saving the person's life. Okay. Let me come to cardiac arrest. Now, cardiac arrest is absolutely different to heart attack, even in terms of how it happens. So, blocked arteries, etc., nothing got to do with that. So, what is it exactly? Let's understand. So, every individual's heart beats with a certain rhythm, right? Your heart, my heart is beating with a certain rhythm, and the rhythm is 60 beats per minute to 100 beats per minute. This is the rhythm of the heart. This is generally how our heart oscillates between 60 to 100. Now, if this person happens to meet with an accident, or let's say this person gets electrocuted, or maybe is drowned, and somebody's got him out of the water, after a long time. So what happens is the rhythm that I just told you about, it goes completely haywire. It becomes haywire. It becomes completely chaotic. So while the heart should have been beating like this, it now behaves in an erratic manner and goes like this. So literally, this is how it behaves. Now that means the heart doesn't know what's happening and therefore it stops. And this is known as cardiac arrest. And it happens suddenly. Therefore, it's known as sudden cardiac arrest. Heart attack is not known as sudden heart attack because heart attack has early warning signs, but cardiac arrest does not. Okay. So let me now tell you how you're going to observe in a person, what are you going to see in a person so that you recognize that, cardiac arrest has now occurred in that person. So let's take the same example. You're on the road and somebody's ahead of you. So if that person happens to get a cardiac arrest, what are you going to observe in that person? The first thing you're going to see is that the person suddenly, without warning, becomes unconscious and collapses on the ground. Immediately, he's going to collapse on the ground. Now, if he's collapsed right in front of you, so obviously you're going to get a bit concerned, and you might want to, get some kind of response out of him, right? So you might want to, tap his shoulders or ask whether he's okay. So you're going to kind of shout or ask him, are you okay, sir? Are you okay? So if you do that, you're going to observe that he's not responding. So basically, he's unresponsive, right? Either to your touch or to your sound, you're calling out to him. Then you might want to check the breathing of that person because you're still concerned, right? You don't know what has happened. So you might want to check the breathing of that person. How do you check the breathing of the person now? You're going to put your finger under that person's nose and you're going to check whether the person is breathing, whether you can feel the breath on your finger. But if you do that, you're going to realize that you're not feeling any breath on your finger, right? Basically, you won't because he stopped breathing. Then you might want to check the pulse of that person. How do you check the pulse of that person? You must have seen doctors do like this, probably like this. If you do this, you're going to realize that there is no pulse either. And that time, trust me, you are going to panic because the scene right in front of you is scary. You are looking at a person who's become unconscious. He's unresponsive now. He's not breathing. There is no pulse either. So what are you going to think now? What is your logical conclusion going to be? I'm assuming your logical conclusion is going to be that the person is now dead. You're going to think the person is gone, right? But I'm telling you today, if you ever happen to come across a situation like this where you're looking at a person showing exactly the same signs I just told you, please do not make the mistake of thinking that the person is dead because that is not going to be true. The fact is going to be that the person has now gone into a cardiac arrest situation. And the second fact is going to be that he needs your immediate help. If you do not help, the person is actually going to die, right? But we still haven't told you how you're going to help. So before we come to that, I still have one more thing to tell you while this slide is up. So if you remember a few slides back, I had told you that even though you may have called the ambulance, you need to help the person before 3 minutes have occurred, right? Within 3 minutes of time. I'm going to give you a logical reasoning on why I told you that. So our body has a very sensitive organ called the brain. Now, for the brain to function fully, it requires a continuous supply of blood and oxygen from the heart, right? Now, if the person's heart has stopped, he's gone into a cardiac arrest situation, which means the heart is not pumping blood, or rather, all the functions of the heart have now ceased. The blood is not going anywhere in the body, neither is it going to the brain. And if the brain doesn't get 3 minutes of continuous blood supply to it, the brain is going to go into a damaged condition. Okay, and in a few seconds, he's going to go into coma, and possibly in about few minutes more, he's going to be no more, right? So that's the reason it's so important at that point of time. You do not think much and immediately come into action and help that person, right? But how are you going to help? So now I have told you, so far I've told you what the problem is. Now we're going to tell you what you can do, how you can help so that you can help the person revive. Also, you can help, also, maybe you can make sure that the person's brain doesn't die, right? So we're going to tell you in 4 very simple steps. Keep writing those things down. And at the end of the session, you can ask us a lot of questions. Okay. All right. So, ma'am, could you please take over?
So till now we have understood that a heart attack and a cardiac arrest are two different things. In a heart attack, a person is telling you he's not feeling well, he's getting chest pain, you're rushing him to the hospital. While in a cardiac arrest, he's collapsed in front of you, he's not breathing, he's not responding. And how to help this person, we are going to learn in the next few steps. So coming to our first step is to recognize that the person collapsed in front of you has fallen due to a sudden cardiac arrest or due to some other reason. So how do we do that? So assume somebody has collapsed in front of you, either he's sitting down or sideways. The first thing you need to do is put this person on the floor. Put this person directly on the floor, and then you have to tap both his shoulders hard and ask, are you okay? Like this. Hello, are you okay? Are you okay? So you can see Anand and me like this. Hello, are you okay? Here you do not have to give him love and affection. You have to hit him a little hard, shout a little loudly. Both the ways we are checking if this person is responsive. So, hello, are you okay? There's no response. That means you know this person is unconscious. Now you have to check whether he's breathing. So there are so many different ways of checking if a person is breathing. Put the finger under the nose, check the artery, check the pulse. All these ways are not wrong. They are correct. But we are going to teach you the fastest way of checking somebody's breathing, and that is by putting your hand on the abdomen. So the person who's lying down, you'll keep the hand here on the abdomen, press it for 10 seconds and check if there is a movement. So you will keep your hand here, press it for 10 seconds and check if there is a movement. Now, if there is a movement, if the person is breathing, that means you know he has collapsed due to some other reason. Rush him to the hospital. But if there's no response and there's no breathing, that means you have identified this person has collapsed due to a sudden cardiac arrest. So our first step, no response and no breathing, we have identified a sudden cardiac arrest. This is our first step. Vilma, can we have the slide, please? So if you can see here on the slide, person is made to lie down, tapping his shoulders, no response, check for breathing, no response, and no breathing. We have identified a sudden cardiac arrest. This is our step number 1. Now we are going to step number 2. Step number 2, we need to call for medical help. You are not a doctor, and even if you are a doctor, this collapse has happened out of the hospital, either on the road or on the street in a mall. So you need medical help. So make sure you save emergency numbers in your phone today. That is hospitals around wherever you are staying and wherever you are working. Make sure both the places hospital numbers are saved in your phone, because an emergency can happen anywhere, anytime. There is also a number 108 which you can dial directly from your phone. So make sure you save that number as well. In case the hospital number doesn't connect, you have an alternative number. Now, when you call for an ambulance, remember it's a very panic situation. Person has collapsed, there's no breathing. So you may just call up the hospital and say, please send me an ambulance quickly. At that point of time, a ward boy will come in a small ambulance with a stretcher. But in this situation, when you call up, you have to specify, please send me a cardiac ambulance, because every cardiac ambulance has a doctor as well as this machine. So make sure in your second step, when you call for the ambulance, you ask for a cardiac ambulance. And also, if this AED is somewhere around you, as I said, we put it in many places here in Mumbai. You may see these a lot at the airports and big malls. So in case you know this AED machine is somewhere around you, ask somebody to get the nearby AED machine. So in your second step, you're going to call for a cardiac ambulance and the AED machine if it is somewhere around. Anand, you would like to add something here?
Yeah, I would just like to add about the number 108. So 108 is a government service number, and I would like you to know that it's prevalent, or rather operational, in 18 states of the country, right? So it's not just about the state that you're in at the moment. So let's say you're out of the state somewhere. Let's say you're going on a holiday. You're on a holiday in some other state, and you happen to see somebody collapse, and you know it's a cardiac arrest and you need immediate help. You can quickly Google to check whether 108 is operational in that particular state. And if it is, you can avail the services and you would get help as soon as possible. Right? Okay,
So we have completed our 2 steps. We have recognized a cardiac arrest and we've called for a cardiac ambulance. Now we are going to our third step. In our third step, we are going to learn CPR or cardiac massage. So first of all, let us learn where exactly we need to do this. So if you can see the screen, think of an imaginary cross on the mannequin. The point between the 2 nipples, the center point here, this is the point where you will be doing cardiac massage or CPR. So if you feel your body from the top, there's a hard sternum, and then there's a soft portion that goes in. This is called the lower sternum. So exactly the point between the 2 nipples, here you will be doing cardiac massage or CPR. Now we're going to show you hand position. So request everybody to please again do this with us. So put your dominant hand straight. If you're a righty, your right hand. If you're lefty, left hand. Make sure your elbow is straight. Your hand is completely stretched out. Open up the fingers and interlock it from the top with the other hand. Remember, your position just needs to be the way Anand and me are showing it. Elbow straight, hands completely tight. This is called the heel of the palm. This heel of the palm will come in this center point, the point here between the 2 nipples, like this. And how to do compressions, we're just going to show you a small video, after which we will explain that even more in detail. So as you can see on the screen, person is made to lie down, heel of the palm, center of the chest, and he is ready to do compressions. Now this compression needs to be done either from the left hand side or the right hand side of the person, not from the head side and not from the leg side. So he's taken his position. Now let's watch how he's doing compressions.
Your turn to practice. First, get into position. Place the heel of one hand on the center of the chest. Put the heel of your other hand on top of the first. Follow along with the drum beat. Let's begin. Push straight down, hard. Push down at least 2 inches. Push at the rate of 100 to 120 compressions per minute. After each compression, let the chest come back up to its normal position. Keep your compressions going until the drum beat stops.
So can you see how he's doing the compression? His elbows are straight, full pressure coming from the shoulders, heel of the palm, the center of the chest. and he's doing the compressions hard and fast. He's not stopping, he's doing this continuously. You need to do this the same way in an emergency situation. So as we saw in the video, heel of the palm, center of the chest, and he started doing the compressions. Now these compressions need to be done at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling. So why this rhythm 100 to 120 beats? Because our heart pumps like this, 1, 2, 3, 4. With the same rhythm, we have to do the compressions, 1, 2, 3, 4. So exactly what are we doing? His heart has stopped, and because the heart has stopped, blood is not reaching the different parts of the body and the brain. And if the blood doesn't reach the brain in 3 minutes, the brain goes into a damaged condition. 10 minutes, he's gone. We do not want this to happen. So this heel of the palm becomes his heart. The moment you keep the hand in the center of the chest, you compress down and you recoil and you come up. Every time you do that, blood from his heart is pushed to his brain, keeping his brain alive. See how important this is. Every time you compress and recoil, blood is reaching his brain. But it is not easy to do this. After some compressions, you will tire out. And if you're tired, you will not do effective compressions. But compressions need to be continued. So what do we do in a situation like this? So one thing is very great in our country. If somebody collapses, we have 10, 15 people come and stand around giving you free advice. Give him water, put a slipper to his nose, put an onion under his arm. We hear all these things. So you have to say, no, I have learned what to do. And you start doing the compression. Tell everybody around you, watch how I'm doing. The moment you feel slightly tired, you tell the person in front of you, now you take a turn and do this. Then you take a turn and do this. Let people do this turn by turn so that effective compressions are done. While the other person is doing the compressions, you can check whether he's doing it correctly in the center of the chest, and you can call the ambulance too. But doing this turn by turn is very important and very effective. But till when do we have to do this? You have to continue doing this till 1, he revives. That is, he opens his eyes, he starts breathing. Then you will stop your compressions. Secondly, if your cardiac ambulance comes, then you will pass him on to the doctor and you will stop the compression. Or thirdly, if somebody brings this machine and gives it to you, to attach the pads, you will stop the compression or you're going to continue compressions. Your next question will be, the ambulance may take half an hour to come or 45 minutes to come. Should we do compressions or should we stop after 10, 15 minutes? The answer is very simple. In a cardiac arrest situation, the person is almost gone. You cannot do anything worse. You can only bring him back to life by doing what you're doing today. And doctors have done the compression even for an hour and a half and saved somebody. So you do not need to be confused or worried. You just continue compressions till he revives or till the ambulance comes. So chest compressions in the center of the chest at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling, doing this turn by turn till he revives or till your cardiac ambulance comes. Yes, sir.
Okay, so there are chances that you may have seen the demo of CPR being done for the first time in your life. That is quite okay, but looking at a demo being done on a computer and actually doing it in real life are two very different things. And generally, people hesitate when it happens in real life. But we do not want the same thing to happen to you. We want the fact that whenever, if for example, certain situation occurs and then you find yourself in a situation where you have to perform CPR on a person because he's just suffered certain cardiac arrest and there is a crowd and everybody is looking at the person, that time you should not hesitate. And for that reason, I want to give you two very strong reasons why you should not. Okay. The first thing is, at that moment of time, you will not be able to give any water to that person. You should not be doing that at all. Okay. Second, you cannot think that you can probably put some food item into the mouth of that particular victim of sudden cardiac arrest and he's going to be all right. That is not going to happen. Okay. You will not be able to provide any medicine or give any medicine to that person because of course he's unconscious, right? So how is he going to intake it? And lastly, you're not a doctor. If you're not a doctor, how will you be able to inject? You will not be able to inject any medicine into that person. So, what is the option left for you to do in order to make sure that the person lives? The option is only one, which is known as CPR. At that particular point of time, without much hesitation, you have to perform CPR on that person so that he lives. Okay. The second strong reason that I want to tell you is that to do CPR is not difficult. It's not difficult at all. You just saw it in the demo. That is all you have to do. Begin it and it will happen. We have absolute confidence in you, maybe more than you have it in yourself, because we've seen people who have nothing to do with the medical line perform CPR on people and revive them. If they can do it, why can't you do it? So don't worry about it at that particular point of time. Just remember what you saw in the demo and jump into action. Start performing CPR on that person. Okay. Let me tell you two or three more things about CPR. So CPR is cardiopulmonary resuscitation. Cardio means cardiovascular. It's about your heart. Pulmonary means something to do with the lungs, and resuscitation means revival. All right. Um, so every single time we've seen CPR being done on television or in the movies, or say we've read about CPR, we've always observed one little thing, which is whenever they're trying to give CPR, along with it, they've also done mouth to mouth resuscitation. You've seen that, right? Trying to give oxygen from the mouth. That's what they say. Now, this is what I want to make clear of. Now, I am making this very clear right now that you don't have to do it. There is no requirement for you to perform mouth to mouth on that person. Okay, if you've seen that person collapse right in front of you and it's just been about a minute or two, and it's just absolutely normal circumstances, it's on the street somewhere, there is no need for you to give mouth to mouth. If you do that, that would majorly be waste of time, so to say. Having said this, I just want to make this clear that, it's not like mouth to mouth is never done. It is done, but under different circumstances. Let's say if a water body is involved, okay, the person is drowned for a long time and somebody's got him out of the water. There is no oxygen left in his body. That is the time when you do it. Or maybe the person is asthmatic, or it's a drug overdose case, etc. That is when you do it. But like I said earlier, under normal circumstances, you don't have to. Okay. And lastly, I just wanted to write down a line. Instead of me explaining it, it's best that I tell you to write it down. It's self-explanatory. Okay. So the line is this: CPR is not performed on a person who is breathing. Okay. So CPR is not done on a person who's breathing. So if a person happens to collapse for whatever reason, you know that the person is breathing, you do not have to perform CPR on that person. And that includes a victim of a heart attack. So even on a heart attack victim, you don't have to do it. Why not? Because he's breathing, right? But if you have understood that the person has stopped breathing, you have to perform CPR, and that's how you save the life of a person of a certain cardiac arrest. Okay? All right. So, ma'am.
So we've completed our 3 steps. We've recognized a cardiac arrest, we've called for a cardiac ambulance, and we've done hands-only CPR in the center of the chest at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling. Now we are going to go to our 4th step, where we are going to learn how to use the AED machine. So this is the AED machine. The full form is automated external defibrillator. In lay language is called a shock machine. In case you've seen this machine in any different shape or color or size, please do not worry. There are different manufacturers, but they all work the same way. So this is how the machine looks from inside. There is a pull lever here. The moment I pull open the lever, it's going to tell me what to do step by step. So I'm going to do that.
Begin by removing all
Now
clothing.
I'm going to switch it off to explain to you, but in case you ever use this machine, you will keep it on at all times. So the moment you open this machine, there's a set of sticky pads. There are 2 pads. If you can see, each pad has got a picture with an arrow indication where this needs to be attached on the body. So this one says here on the right hand side below the collarbone, and this one says here on the left hand side below the ribs. So just like how it's given in the picture, I'm going to peel it off and I'm going to attach it and show it to you. So just like how it is given in the picture, I've attached the pads, and remember you need to attach the pads the same way. Now these pads need to be attached here because our heart is here. When the shock is delivered, it needs to go through the heart. If you attach the pads like this or any other way, the shock will not go through the heart. This is the reason why the pictures are given and you have to just attach it as per the picture given. Second important thing is these pads need to be attached on dry and bare skin. So if the person is taken out from the water body or it's raining a lot or he's perspiring a lot, you need to wipe that portion and attach the pad so that they stick properly. Secondly, it needs to be attached on bare skin. If you attach them on clothing, they're not going to give a shock because they're electrodes. There's a little problem in this. If it's a public place and it's a man, what will you do? Just pull up the shirt, open the buttons, and attach the pads. But the same thing can happen to a lady. At that point of time, modesty will be in the way. What will the public say? What are you doing? Why are you removing the clothes of the lady? So we normally have an issue there. So we have a small solution for that. If the lady is wearing a sari, you can adjust the blouse and attach the pads. But if it's a full suit, then if you can see here inside the box, there is a pair of scissors. All that you need to do is remove this pair of scissors, cut open this portion of the clothing, cut open this portion of the clothing and attach the pads. You do not need to remove the whole clothing. So modesty will also be there and you'll go ahead and save the life. So we've attached the pads on dry and bare skin. Now let's listen to what the machine is saying.
Place pad. No one should touch the patient. Analyzing.
It's analyzing the heart rhythm of the person on who you've attached the pads.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now.
Can you see this button is flashing?
Press the flashing orange button
The machine
now.
is saying to press the button and
Deliver shock now.
I'm going to press the button now.
Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR.
So what did the machine do? The moment you attach the pad, the machine first of all analyze the heart. You have checked no response, no breathing. The machine is rechecking that. Once the machine checks the person, the machine will decide whether the shock is required or not. You are not going to decide that. If the machine feels the shock is not required, machine will say shock not required. But if the machine felt that the shock was required, there was a button that was flashing. All that you need to do is press that button to deliver shock. But at that time, you do not have to touch the person because he's getting a shock. If you touch him, you will also get a shock. There he's lying down, here you will be lying down. 1 + 1 free. So do not touch him, just press the button. After the person gets a shock, the machine says, now it is safe to touch the person, start CPR. So you will not remove the pads, you will not switch off the machine. You will continue to do chest compressions in the center of the chest because the machine has asked you to do that. For 2 minutes, the machine allows you to do compression. After that, it goes into the second cycle. Second time, it is going to decide whether the second shock is required or not because it's not necessary in one shock, his heart may start pumping. He may require 2, 3, 5, 10 shocks. But how many shocks to be given, the machine only is going to decide that. All that you need to do is listen to the prompts and use the machine. Remember, this machine is made for your use. So if you have the machine in front of you, please don't be afraid. Go ahead, use the machine. You can save somebody's life. Yes, sir.
I'm gonna talk about the AD, the same thing that I told you about CPR. You know, if you ever happen to come across this machine and you know that you have to use it, please don't hesitate to use it. For a very simple reason that this machine has been made for the common people of the country to use. It's not a machine that a doctor needs to use. Okay, and if you know that this machine is made for the common people to use, imagine how easy it would be to operate such a machine, right? It's not difficult at all. All you have to do is put the pads over the body, follow the prompts, and that's all there is to it. So I'm not going to go into the details of the machine because Sumaya has already explained it to you. I just have two requests to make of you. Now, the first request that I want to do is that I want you, after the session is over, go on to Google, type AED, and you're going to get a few articles about the AED. Read a few of them and educate yourself in understanding what this machine is all about. Right? If when you read those articles, you're going to realize that this machine saves lives. And if you step out of the country, everybody knows about this machine. It's only in our country we do not. So I want you to educate yourself about this. And the second request that I want to make of you is that once you have understood that this machine actually saves lives, please consider buying one for your society. not for your house, but for your society. So if you happen to, and if you consider buying for it, if you're actually buying it and you're keeping it in your society, your society is going to become safer. And the reason I'm telling you to go for, buying it is because when sudden cardiac arrest occurs, the person has only 3 minutes of time. And within those 3 minutes of time, it's very difficult for an ambulance to arrive and very difficult for a doctor to arrive. And if in within those 3 minutes, you have this machine and it's small, it's portable, you can immediately get the machine to the victim, put the pads over the person, and quite possibly the machine is going to save the life of that person. That's the reason it's so important. We have this, a machine everywhere in our country, not only the housing societies, but also in schools, in colleges, in gyms, all those places. So I am making a request to you to please consider buying this machine, just one machine, and keeping it in your society. That will make your society safer, and in a small way, it is also going to make the country safer. Okay. All right. So, man.
So we have completed our 4 steps. We've recognized a cardiac arrest. We've called for a cardiac ambulance. We've learned handling CPR, and we've learned about this machine. Just few more things about this machine. This machine is battery operated. It does not work on electricity. It works on battery, and the battery life is for 5 years. For 5 years, you do not need to bother. After 5 years, you can get the manufacturer to change the battery and continue to use the machine. The only thing is, if you use these pads, these are one-time use pads. So if you use these pads on somebody, they need to be changed after every use. So there's a set of pads attached to the machine and an extra one in the box. In case you use the pads, get them changed and continue to use the machine and get another set ordered from the manufacturer. The approximate cost of this machine is about 1 lakh, but this machine is not a machine that you need to keep in your own house. If it's a big housing complex, you can have one machine, big malls machine, police stations machine. If machines are placed in different places like that, India will be a safer place to be. So this was about the machine. Now we are going to show you a small video. It's a 2-minute video with which you understand things even better. But 2-3 important points before that. Scene safety is very important. If somebody collapses in the middle of the road, fire hazard, electricity point, railway tracks, make sure you take the person to a safe place to the side of the road and then only do what you have learned today. Secondly, a witness fall is important. If somebody has collapsed in front of you or somebody has said this person has just collapsed, it's when you were helped. If 2-3 hours have passed, then there's no point in doing these things. And third thing, if somebody collapses on the bed, make sure you put the person down on a hard surface and then only do what you have learned today. So this was about this. Let's watch the video.
Sumaya, before you play the video, can I say just one thing?
Sure.
Okay, so remember I told you to buy this machine, keep it in your society. Just wanted to make one thing clear. We told you about this machine because we wanted you to have knowledge about this machine, but we do not sell the machines. Okay, so if you want to buy this machine, you can go over to sites like Amazon.com, or you can search for the number of the manufacturer, give them a call, and they will come over and install the machine for you. But just wanted this to be very clear that we do not sell the machines. Okay, so man.
Let's watch the video.
आपको याद है ना, हम लोग उस दिन शादी में गए थे और आपको मेरी वो फ्रेंड याद है ना, सुनीता? कल सेम कॉस्ट्यूम ना मुझे भी अपने लिए चाहिए। अंकल, याद है आपको मैंने बोला था? अंकल 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 प्लीज हेल्प मी प्लीज हेल्प मी।
Oh my God!
चलो देखते हैं।
अंकल
क्या हुआ?
प्लीज आप एम्बुलेंस को कॉल करेंगे?
एक मिनट मैं देखता हूँ। हेलो, क्या आप ठीक हैं? हेलो, इनको कार्डियक अरेस्ट आया हुआ है। आप जाके शॉक मशीन लेकर आइए, तब तक मैं इनको हार्ट मसाज देता हूँ।
Please notice his position, elbow straight, pressure coming from the shoulders, heel of the palm, center of the chest.
ये बॉक्स यहीं रख दीजिए और जैसे मैं कर रहा हूँ हार्ट मसाज आप वैसे ही करिए.
So there's no waste of time. Till the time one person is opening the box and touching the pads, the other person is continuing with chest compressions. Pads are being attached as per the picture shown. Machine has prompted a shock. And because the heart has got a shock, it has started pumping by itself. Person is come into consciousness, he started breathing. You have saved a life, such an important thing. Till then, the cardiac ambulance has arrived. Remember, he needs to go to the hospital for medical treatment, even if he's come into consciousness. And after 3 weeks of medication, now he's leading a normal life. Young and old, cardiac arrest can happen to anybody, anytime. And every 1 minute you think, should I help or not, his chances of survival decrease by 10%. So please go ahead, spread the awareness, what you have learned today, teach more 10 people, teach your family, teach your friends, and explain how important this is. Everybody should know CPR above the age of 15 years. But when you're teaching somebody, don't tell anybody, come on, lie down, I want to do CPR on you, because CPR is not done on a person who's breathing. That is why a person who is having a heart attack, you did not do CPR on him, you rushed him to the hospital. While somebody who's collapsed in front of you, over him only you did compression. So understand the difference, go ahead and help, you can also save a life. So with this, we come to the end of our session. Thank you very much.
Thank you so very much. Have a nice day. Bye.